Welcome to the Driven Dental Podcast, where all things dental drive our curiosity to have meaningful conversations about self-development, business scalability, and prioritizing people over profits. This podcast will leave you ready to drive your practice to new levels of success. I am Matt Robinson, COO and co-founder of Operation Dental, writer of the Driven Dental Practice, and your host. Dentistry is about its people. Let's hear from them. Hello and welcome to the Driven Dental Podcast. The introduction to this episode will be a little different than normal. When Dr. Stallard sat down to record, we started talking and never stopped to have a formal introduction. We'll pick up the recording where he was summarizing the role his parents played in pushing him to excellence before his journey in dentistry. Dr. Stallard is truly a next-level dentist, both clinically and from a mindset perspective. He offers some great advice and guidance to all dental professionals in the next 60 minutes. Enjoy. If somebody would ask me, why are you working so hard? Or why are you doing this? Or what motivates you? I had no answer.
I didn't for a long time. I didn't,
What is it now then?
As of super late, it's as you go through life's seasons, right? I see my kids, it's just everyone talks about that, but until you experience it yourself, you realize like, hey, that's what everyone was talking about. You show up to work and you want to do well for your family, for your kids, and be a good example for them. So that's what, once again, it's what my parents did. They worked hard and it's all coming full circle now that I lived the life, and now I'm in this season with my family, and I'm proud to be in this spot and be able to teach my kids.
Yeah.
This is life. These are things. My dad always told me, don't make the one mistake you can't recover from. There's a lot of good lessons that like I said, everything just makes a little more sense now. And over time, I've become more eager to learn because I understand, everyone's got something to teach you. And the more conversations, the more experiences and things that you can have, any little tidbits are going to be great and could turn into motivating factors for you.
Did you ever have a season where you strayed away from working hard and things were not going the way that you wanted them to?
I did it in different parts of life, sure, right? I mean, in sports, I've had that where I just got burned out. My dad was pushing me too hard, and I was like, I want to quit. Stallards never quit. They never quit, right? So I had to learn to navigate, in early part of my life, once again, the team, you have wins, you fail, you have to learn to navigate those. And then, you get into dental school even. And, I was thankful to graduate number one in my class, right? But you have friends and you have targets on your back too. And there's stress to be at the top. It's a stress like these moments in life, whenever you're trying to be the best, sometimes you break, you just fall apart. And interestingly, like in that moment, I call my mom, or I don't call my dad. I call my mom because sometimes you need that, like caring, you can't just be this tough shell all the time. You need the nurturing, just like you give your own kids, and then, after dental school, you get into real life. I started working with you all, and a major part of my growth was joining the practice I'm in and having Dr. Preble, having a great mentor. When I first graduated, I didn't want a mentor. I thought I was good. Yeah. And I didn't realize that I was horrible. And I spent the year with him. Things started getting better. I learned more procedures. I got better. And then I got complacent. I was like, okay, yeah, I'm making enough money. I'm doing enough cool things. Do I really need to get much better? Nah, I'm good. And I probably rode that way for a year and a half.
Really?
Yeah. I was just like, yeah, I'll just show up to work. I'm doing fine. I'm good. Whatever. I'll look at some stuff on dental clinical pearls or something. I'll do some reading, and that'll at least keep me up to date, right? And then I would say another fire got reignited maybe 6 or 8 months ago, and hence, me jumping back in hard to continuing education recently. I was like, man, like there's actually just so much more to learn, and I'm not tired anymore. Like I'm ready to go back and hit it hard again. And that's turned into, sedation training, more hardcore implant training, and realizing it's okay not to know everything. And the less you know, the more talented people you surround yourself with, I can just grow infinitely, because some of the best people that I follow in the world now are still humble enough to say they don't know it all, so that means I'm not even close.
Yeah.
So that's kind of from the beginning to now, like some of the challenges. You can't be on all the time. You just can't be. But I'm hoping it doesn't turn into a year again. For the next time it's a little bit shorter.
Yeah.
But we all need breaks.
Did a lot of your break kind of have to do with having 2 kids? How old are they now?
4 and 2 next
4
month.
and 2.
Yeah, 4 and 2.
So was that a big part of it? You can only do so much at work and then juggling the parent role?
Life became different quickly. And they, once again, until you experience it yourself, you that baby comes out in the operating room, and I don't know about you, but I was like, oh no, what have we done? It's like we have to take care of this thing now. And
do you go through your day, if you're being tempted to do something you shouldn't do, or just slack, be lazy, whatever it is, do you think of your children watching you, or do you think?
I haven't gotten there yet.
Okay.
I haven't gotten. It's not that deep yet.
It's powerful
because I still have my own internal motivation that trumps that.
Got it.
But I'm sure as my kids get older and I have more experiences with them, that motivational aspect's going to become the strongest.
Yeah. I heard something super powerful. I don't even know who said it, but he was talking about his parents and that the struggles he had, and he said, I don't want my kids to tolerate me. I want them to be proud of me. It's like huge difference there. Because you have no choice of who your parents are.
Yeah.
And so you're putting up with your parents, or you're proud of your parents.
Right.
And so like for me, I have 2 kids as well. And if I'm having a bad day, whatever it is, like I need to buckle down, because I need Grayson to look at me and be proud of what I'm doing. And he needs to be better than I am. So I have to set the bar as high as possible.
And that's funny because I think in the previous generation, it was stated differently, right? It was like, I want my kids to have it better than I had it. But now it's that, I think that's a better mindset, is because it's empowering your kids. Like I said, going back to the beginning, right? The struggle that I have is like, how did my parents do it? Like, how did they get that fire in me? And I think that's the way, right? It's not, don't hand it to them.
Yeah.
Empower them to want to achieve things on their own. And that's what I've really buckled down on lately in my own practice, right? Is, maybe I was leading wrong. We're not perfect, and we're all growing, and I'm learning each week, how to get better. And, just recently I've learned that, I've not been very motivational and empowering to my team. And that's something I need to work on, which, once again, between the kids and the team, it's all the same. It's all kids. It's all family.
Yeah.
So, a lot of these lessons go hand in hand.
So you graduated number 1 from dental school. I assume, well, you said yourself that you came in thinking that you knew everything. What is your number one bit of advice to somebody who's just graduating from dental school, number one or not, in their first year of work?
The first year of work is you need to learn like how to talk to patients, you know, how to show up to work and manage a team, right? If you can control your team, you can talk to patients and start getting some repetitions in, right? Because it's like anything. If you're a plumber or a dentist, you just need to do a few things so that way you naturally get better at it. Or you make, aim small, miss small, make small mistakes. That way you learn each time. And then over the course of that first year, if you're not fortunate enough to have a great mentor in your practice, then that's the things I would focus on, But A plus is finding that unique situation, being in a place where you can have mentorship. Because my first year out, I went with one of my buddies who also now works with us, and we're like, hey, let's start a practice with another DSO. We talked him into it, and it was great. It was great because I was working with a buddy, But we relied on each other to answer each other's questions, even though, of course, that DSO had quote unquote mentorship, right? They weren't in the practice, so therefore we just had to answer each other's questions. And he was trained the same way I was trained, so it was blind leading the blind, So we grew some together. I tackled molar endo, but it was like I had that within me to want to learn it and want to try it and be willing to fail to get better. So we naturally pushed a little hard, and thankfully had some good specialists around that could bail us out,
Right.
But when I joined you all the following year, and I had that mentorship in my office, I gained 10 years of experience in 1 year. And that doctor has since retired, and I still, anytime I see him, I thank him. I was like, just that year changed my whole trajectory.
What did he teach you?
He humbled me really quickly. He let me know when I walked in. He was like, I think you're going to work out, but you don't know anything. And I have the type of personality to be like, all right, I guess I don't know anything. So let's learn, right? So he started at the very beginning. He was like, you don't even know how to do a filling. And I'm going to show you why you don't know how to do a filling. And I did, even just some simple class 3s in the anterior. And I think my first time, like, patients had to come back. They had a little extra composite or something. And he was just like, F, took out a sheet of paper, put it down, drew teeth, and was like, this is where you suck. He's like, all right, and then we're going to go to the next thing next time you mess up. And so we went through that for a little while. He took his papers out. He drew things. He wanted to teach me. He's like, if you're going to take over this practice, you have to be as good as me. And it was a goal because he was the super GP, right? And, sedation, implants, endo, bracket and wire ortho. I mean, just like you name it, the guy could basically do it, right? So we did that style of training for a while, and then we started to get into the more interesting procedures, right? The surgeries, the implants, and he taught me some about ortho and braces and how to adjust bites, how to work joints, right? Some of this knowledge I just didn't even know existed. At the end of that year, I had learned so much that I realized I didn't know anything. I was like, oh my God, like I shouldn't have touched anybody my first year. I shouldn't have even looked at them, So by the end of it, it was, you're not comfortable with that procedure? Okay, well, I put it on your schedule for Monday. I'll be here. If you have questions, I'll be in the back. And it was like my first time doing certain things. He was like, "Oh, apicoectomy? Okay, well, that's fine. We'll put it on your schedule on Monday. I'll just draw it out how you should do it. And then if you just have some questions or get hung up, then I'll come in and take a look." So trial by fire.
Mm-hmm.
And once again, it was just the way that I learned, it worked out.
Mm-hmm.
So lucky, fortunate, however you want to say it, to be put in that situation. It worked out for me, and I was able to grow 10 times in a very short amount of time.
What can a dentist do if they go into a practice that they're the only doctor there, or they work with an associate who doesn't want to teach them?
It depends on the opportunity they have,
Mm-hmm.
right? So if you're in private practice, then you're gonna. I think there's some great resources online. Like I said, dental clinical pearls, and I hate to say it, right, but YouTube and certain things like this. I mean, at the end of the day, is like you see things enough and you have a baseline knowledge, you can kind of put two and two together for the most part. You shouldn't necessarily learn surgeries off of YouTube, of course, but if you can at least challenge your brain to think differently by watching a YouTube video and understanding, oh, well, that person did it this way, then it doesn't mean go and do it necessarily, but you learn something,
Mm-hmm.
right? And you might be able to apply that knowledge to something else,
Mm-hmm.
right? So if you're in a private practice and you're stuck a little bit and you feel like your lead dentist, your owner dentist is not willing to help you out too much, then you're going to have to seek out those educational opportunities in the form of good old CE or just reading and learning. If you're fortunate to be in a company like this, then we proactively try to match you up in a good situation that you want.
Mm-hmm.
In the rare circumstance we can't do that, then we have a team of dentists that are ready to help at any given moment,
Mm-hmm.
even coming to your office, whatever we need to do, So that, I would say that's going to be the biggest difference between the two situations you might find yourself in, right?
So that's clinically, right? The clinical aspect of being a dentist. As far as the leadership or the manager aspect that you talked about, what was your mindset when you first started working here compared to where it is now?
When I first started working here, it was in a transition, taking over a previous, fully private practice. Smaller, cozy, small team, right? Single dentist, couple hygienists, couple assistants, off to the races, right? I come in second dentist, and this practice has seen a second dentist for short stints in its 30-year career, but not as of late.
Mm-hmm.
So I come in, and there's a pretty good transition there. It was an interesting one because at the time the owner dentist was hoping to slow down, so it was almost as if I could partially take his place. The practice was on cruise control. I wouldn't say in terms of correct ranges and margins and things like that. It wasn't necessarily looking perfect on paper, but I could show up to work and I just kind of did the work and could go home. Didn't really have to think about it very much because I didn't change anything. And we managed to do okay, with that mindset of I could almost clock in and clock out and not think about anything. And the practice ran itself, right? Dr. Preble started to retire more, transition out slowly. We added a second dentist. And, we realized like, okay, well, things aren't really going to work out perfectly. Like we can't just show up to work anymore, There's got to at least be a little bit of effort on my part. And I think I tried, I guess I'll speak from just the effort at this point, right? Not necessarily leadership theory, but I tried a little bit more. I wouldn't say I had to devote a lot of time because I chose my associate carefully and knew that we would work well together and we could work things out, figure out whatever problem we ran across, we could just kind of figure it out. There wouldn't have to be much leadership applied. And it kind of worked, So I was able to maintain bad leadership habits because we could outproduce our way out of the problems, So we'll fast forward to now, at a third dentist, right? For lack of better words, and these are probably the bad words, but it kind of almost felt like a crash and burn. We had been on cruise control for a few years now. We managed to grow with the second dentist, and the practice grew, and things just felt like it was okay. And like, yeah, sure, let's just add a third dentist. What could go wrong, right? And then a lot of things really, the internal issues that we had in the practice that we could sweep under the rug, everything came to light all at the same time. And I had to take a step back and realize that I was not a leader for all these years, and kind of had to really go back to, during dental school, I read leadership books because I knew one day I was going to have to do something, right? Undergrad, I graduated with a leadership minor because, once again, I figured, I was like, it's probably some good skills to have.
Yeah.
So I kind of dusted off a few things, and it's like, okay, how do we really manage a team, right? I called for help too. I'm in this organization, and I'm it's a two-way street. Sure. I help you, you help me, right? So I called on you all. I was like, we need some help. And I'm not too knowledgeable at the front desk area, right? So I called in some people, like, I just need you all to help me, like, see what's wrong, because I don't even know what to look for, right? So I was like, you all take care of the front, I'm gonna work on the back, and together we're gonna come together and fix this. And right now, these are more actually recent things that are happening, and I'm right in the thick of it. And I'm very motivated, and I'm very confident that we're gonna come out on the other side, and we're gonna be a machine. But there's gonna be a little temporary pain and misery, right? Because if you can't just float through life. Yeah. I mean, you're gonna have some road bumps, and this is just a road bump, and it's an unfortunate one, and like I said, at this season in my life, it's like, let's go. I'm excited. Let's tackle this head on. Yeah. You can't stop me. I'm Derek Stallard, right? So
Stallards don't quit.
Stallards don't quit. They don't. So it's like I said, I think it's a new season, and with struggle comes excitement, because you know that if and when you make it to the other side, it's beautiful. It's beautiful. And it's when I look back on my sports days, my high school days, I was like, man, like all those times I was frustrated and sad or whatever, like all the good that came out of it, and now it's you wish that as you get older, those things go away, but they don't. And so you just have to find a way to be excited about the growth.
Yeah.
And everything that comes with it. So right now we're just in that, boy, this is fun. Yeah.
This is just a side note. I don't even know if it applies to anything, but I'm excited to see what happens with you, because I don't think people realize how young you are. When I know for me, have faced very similar things in this industry, but I'm 9 years ahead of you. So for you to have the mindset you have now, just thinking in 9 years, like, it's just, I'm excited for you.
I'm just happy that I've got the fire back.
Yeah.
And it's kind of sad to realize, looking back, that it disappeared. But once again, I have different priorities now, and
Mhm.
I think it's going to be harder to lose the fire.
Yeah.
You know, um, you don't want to burn out, and I'm not
Right.
near that. It's just I'm just excited. I'm happy that I'm willing to put in the work again. It
Mhm.
feels good. I'm back
Yeah.
to the, undergrad days of let's just grind it out,
Mhm.
So it's I'm excited.
Yeah. So how long into your dental career then would you say that when do you feel like you became good? Like, I'm a solid dentist. I can work multiple columns while still seeing hygienists and run it effectively and do good work.
Starting my third year.
Third year.
Third year. No question.
Hmm.
Like, because once again, you have a couple years under your belt, you've worked on patients, you've learned from your mentor and from your mistakes. Excuse me. You know how to become more efficient, how to um, basically, like, anything just comes your way, you can navigate it quicker whenever you have just had more experience.
Hmm.
So I think, having the first year with the other DSO, having the mentorship the second year, and starting the third year fresh, I when I first started, I was like, how do these dentists hit $100,000 a month? I was like, that's impossible. I'll never do that. Like, I was struggling so hard. I was in a startup with a DSO, so I mean, there was not any tenure for patients there, and
Hmm.
I was just trying to convert whatever walked in the door, but my skill set was somewhat limited, and this particular place sent out production reports of every dentist in the entire company, and there was numbers that just shocked me. I was like, how do these people, I can barely do 50 or 50,000, 60,000 a month. I'm
Hmm.
dying. Like, I'm dying. And these people are doing hundreds of thousands of dollars a month. And I'm like, I don't even know if I can hit 100. I just don't know. So I was a little discouraged. And I was like, maybe that's why I was like, maybe this isn't the place for me, you know? Um, and then that second year with the mentorship, I don't know if it was the second year, maybe it was. One second year, early third, I hit 100.
Hmm.
And I was like, oh my God, I did it. I did the impossible. I did the impossible. And at that moment, when I hit 100,000 in production, I was like, there's nothing that can stop me.
Hmm.
It's not, nothing's impossible now because I did the impossible already, you know? And since then, there's been new goals since then.
Yep.
And now 100 is like, I'm like, if I don't hit 100, then why am I even showing up to work? You know?
Hmm.
So it's like the mindset's just completely changed.
Hmm.
Um, but those experiences, that third year, you know, you really, you have what it takes
Hmm.
if you had the proper experience in the prior 2 years
Right.
to really take off.
What advice can you give on running an efficient two, three chairs while seeing hygiene?
First and foremost is take the time to train your assistants. Stay late after work. Whatever you have to do to make sure they understand dentistry. Because if they understand dentistry, they can be a dentist when you're not in the room. Because if the room is not moving along after you walk out, then you're dead in the water. So if your assistants, if you're just, I mean, you're a new grad, you're doing fillings and crowns, maybe some extractions here and there as a general dentist. Uh, your assistants need to know that like the back of their hand, every aspect of it. Why do we diagnose it? Because once again, a patient walks in, you start at the beginning, and then you finish everything, and they walk out the door. So you have to be efficient from the time they walk in to the time they walk out the door. It's the whole appointment. So your assistants are critical in that, because if they're good, then they can sit them down, get the X-rays. They understand dentistry. What treatment is the doctor going to do? What's he going to recommend? Tell the patient about it. Let's go ahead and put it in the computer before he
Hmm.
gets in here, just so that way it's ready in case that's exactly what he's going to do. So then I walk in. Oh, by the way, hey, if you trust your assistant, we're going to be doing this. Okay? walk in, take a look at the x-ray. I recommend this, right? But everyone already knew that.
Right.
Because your assistant had put it in the computer, had told the front desk about it. So they're already getting the treatment plan ready, right? And then, they're working as a team. They're setting the room up. Your other assistant, hey, we're going to be doing this, right? So they're setting things up. If I tell the patient, hey, is there any remote chance you're going to do something today? Is it okay if I get you numbed up before we present the treatment plan? Yes or no? I would say the majority say yes, probably 60+%, right? So therefore, I don't have to wait on the numbing to set in. They're going to be presenting the treatment plan while the numbing is setting in, while they're setting the room up. Then I can just walk back into the room, do the work, turn the room, we're on to the next one. Mm-hmm. So if your assistants and your team understands how this works, this is how it flows, and your assistants understand dentistry, this is what we diagnose, this is why we do certain things, this way, then there's a decent chance you're going to line up, your mentality is going to align, and they're going to choose the right thing, and you can just carry on.
Yeah.
Then you go to the next room, and you do the exact same thing. Right? Mm-hmm. So if you do, once again, they're doing all that, the numbing's setting in, I'm going to check hygiene. So I'm relaxed. I'm not in any rush because, on the top, I'm waiting 5 minutes. On the bottom, I'm waiting 12 minutes. So it's all calculated. I know exactly the amount of time I need to be in certain places. I know I can afford to do this mm-hmm. many things while I'm gone.
Right.
And I have to be back at this time.
Yeah.
Recently, we've introduced headsets, and that allows them to be like, boom, we're ready. Mm-hmm. So I've got air traffic controllers. Just tell me where to go. You need to go over here, go there. When you get up, go there. Right? Mm-hmm. So you put all of it together, it's a beautiful symphony.
Yeah.
And you can be more productive and see more people, and you don't have stress. And as you get more experience, you tend to work quicker as well, right? Obviously dental school, it's hours for a crown prep. My gosh, you might be there all day, mm-hmm. And now it's like, average tooth is like, I don't know, 7 minutes, something like that. Like, it's not a very long time. There's more difficult patients, plus or minus, right?
Right. You
always run into one that's like 12 or 15 minutes. You're like, oh God, am I ever going to get out of here, But for the most part, you need to have you get your timings down. You give your front desk, a sheet of like, this is how long it takes me to do these procedures, schedule accordingly, right? And as you get better each year, your times change. So that way your team mm-hmm. can create the symphony for you.
What can a new dentist learn from the assistants as well?
Plenty. I've been fortunate to have assistants I have 2 assistants currently that are 20 plus years in, and 20 plus years in advanced offices. Mm-hmm. One of them I acquired with practice, and the second one has come in from another practice that strictly did full mouth rehabs. So like, she would hand make night guards with powder and liquid and adjust them on articulators and stuff. And I told my wife, who's also a dentist, I was like, my assistant knows more about occlusion than you. And she's like, I have no doubt she does. Like, my assistants are very highly trained, so other dentists will know about Dawson courses, Pinky, whatever. My assistants are trained in that, mm-hmm. So like, they're very, very high end. They can do a full blown bite equilibration. They don't even need me in the room. Obviously, I have to be in the room to do it. But if your assistants understand and know these things, mm-hmm. They can, like I said, they can move you along. They can treat plan better. But as a new grad coming in, if you have experienced assistants, they can expedite your growth too. Mm-hmm. They'll hand you things like, oh, you should try this. How about that? You should maybe next time do that, because they've watched their dentist do it for 20 years, mm-hmm. 10 years, whatever, right? And if I have a new assistant come into the practice, if they have a little bit of experience, I'm willing to learn. Like, what do you have from your previous 5 years even.
Right.
What'd you learn? What'd your dentist do for this? If you were in this situation, how would it work in your previous practice?
Mm-hmm.
Right? So now I know to ask those questions, but as a new grad, you don't know.
Right.
And the other doctor too, that joined me as the associate, he worked in Michigan before. He said, I learned so much from my assistant. Oh my gosh. You wouldn't believe how much knowledge they have. You have to be humble and willing to accept it because they know more than you. When you first graduate, they know more than you,
Mm-hmm.
and you need to know that.
Mm-hmm.
It's just like some of the nurses in the hospitals, and a resident, graduates into a physician, and they show up, boom, I'm a doctor, and the nurse is like, slow down. You don't know how this works.
Mm-hmm.
Same thing here. Your assistants can help you grow tremendously. And if you have the right attitude and a good relationship with them, they're going to want to help you grow.
Yeah. What do your comp exams look like now compared to when you were a new grad?
They're more focused because I can look at a few x-rays. I can go in, I can read a room pretty quickly within probably 10 seconds. And I know which direction the treatment needs to go, right? Previously, when I first started, you over-explain, you give too many treatment options, you try to impress them. Oh, I know this much, right? I know this much. But now I'm able to read the room quickly and give 1 to 2 options.
Mm-hmm.
It's like we can go A or B here. Obviously it's time and money. Time and money. You have to figure out what's more important to you. If it's this, then we'll go this way. If it's that, we'll go that way. And I find out right off the bat because I don't want to waste my time talking about something they're not going to do.
Sure.
So a comp exam now, 7 minutes, 5 minutes,
Mm-hmm.
because it's focused. I know exactly what I'm going to talk about when I walk into
Right.
the room, and if your hygienist can preheat you before you go in, you're fully loaded.
Mm-hmm.
Then I have them repeat it in front of the patient,
Right.
what we spoke about, right? So that way, the patient's hearing it multiple times,
Yeah.
hear it up, hear it there, hear it in the front, right? And we're not selling treatment. We're just advising patients,
Mm-hmm.
and they love it.
Yeah.
They love it. They don't want to be sold. They just want to be informed, and they're like, wow, man, that could really benefit me. I'm like, heck yeah, it can. Let's do it. I want that for you. Let's do. It's going to be great. You're going to love it.
Mm-hmm.
You pump them up a little bit. You do that, they're like, heck yeah, let's go.
Mm-hmm.
But if you're like, oh yeah, you got a few fillings and we'll get around to it when we can, it's like, are we?
Yeah. Mm-hmm.
So, and that has more so come into place on years 4 and 5, right? So in the first 3 years, it's once again, you don't realize what you don't know. I became better clinically
Mm-hmm.
in those years, but I still didn't quite understand. I was in my first practice and I was like, all right, hopefully they can afford a bridge. I know it's a lot of money, and they might have to take out some financing or something, and bless their heart.
Yeah.
I don't know. Now I walk into this new practice. My mentor is selling $20,000, $40,000 treatment plans, and I'm like, I need a mindset shift here.
Mm-hmm.
I don't even know if I can talk to somebody about that.
Yeah.
How am I going to do that? Like, I can't even. $5,000 is a lot of money, and then of course you just have to do it.
Mm-hmm.
You have to go in. And what I did was, I wasn't trained in it, but if I had a patient on my schedule I thought needed that treatment, even, on my doctor column, then I would talk to them about it.
Mm-hmm.
And I would be like, this is what you need. I'm excited for you because this is a great result that you can get. And it costs $20,000. And I stare them right in the face,
Mm-hmm.
right? It's going to cost $20,000. I'm going to have Dr. Preble come in and talk to you a little bit more because he's the one who actually can do the treatment. But I just wanted to let you know that this is really going to be a great option for you. So I'd practice on people that I didn't have the stress of having to deliver it.
Right. Interesting.
So that way I would get confidence. Okay, 20,000. Now it's like, if we're doing upper lower arches, right, and it's $45,000, $50,000. I just like, we have different options of cars.
Mm-hmm.
I'm like, we can do a very nice car here. 48. I mean, some of this stuff costs 48. This costs $50,000. Okay, and boy, is it life changing.
Mm-hmm.
It's going to be great. Here's some examples of what we've done, and we have patients that might want to even talk to you if you want to talk to them about it. It's just you refine your technique
Mm-hmm.
over time, and you try. It's like you try so many times and you fail so many times
Mm-hmm.
that the more that you learn, the more you talk to people, the more you read, you can figure out, okay, this is how people work a little bit, or at least my population where I work,
Yep.
right? It's obviously different if you're in Tennessee, it's different if you're in Utah, whatever. So at least for here, I've kind of honed in, for the most part, the general population that I see, and I can cater my words quickly
Mm-hmm.
to that individual, to that ethnicity, to that religion. Like, because we're a melting pot here. And sometimes, it's like, okay, that I've learned this culture does the things this way, so I have to present it this way. Or I don't even talk about that, because this subset of the population, they don't do it. So don't even waste your breath,
Mm-hmm.
So it's an interesting place to work. And I would say that's come full circle for me more in, years 4 and 5,
Mm-hmm.
because clinically, like I said earlier, is I kind of was in stalemate,
Yeah.
but I was growing other ways that I guess looking back, I probably didn't realize,
Mm-hmm. How do you, so dentistry is obviously a game of reps, right? You have how many, 6,000 active patients? Like, you see a lot of patients.
Yeah.
There's a lot of opportunities. There's a lot of conversations that I'm sure are very repetitive and boring. If, let's say you're a dentist who's scared to present something or scared to do a procedure that you want to do, but you're just looking for that right case endlessly, and you're pushing off those conversations, how can you dig in and force yourself to have those conversations?
Well, probably goes a little deeper.
Okay.
Is if you're scared, are you ready? Are you trained? Because Dr. Preble told me, he said, good job selling it. Now you got to do it.
Mm-hmm.
Right? So if you're that scared, my first step would be make sure you're ready. Train, study, right? The next step is that if you're just a little shy, let's say you're shy, right? Then if you're fortunate to have a senior doc in your practice, then let them know. Say, hey, I'm ready. My wife's going through that currently, right? She has a new grad working with her.
Yep.
And she's going to be great. She's pushing herself. She's like, I'm ready to do some root canals. Okay. So that's the next step, is if you have a lead dentist in your practice, if you're in the right practice, they'll be happy to train you.
Mm-hmm.
So, in that circumstance, she does some stuff. My wife comes over and checks halfway. Okay, great. Looking good. Keep going. Before she does her final fill on her root canal, let me double check it. Let me check your x-rays. Good. You can fill it in. It's like school a little bit, right? That's, like I said, that's if you have that opportunity, If you, outside of that, if you don't have it inside your own practice, then you need to have a mentor come in. You truly need it. If you're in private practice and you're alone, then you're going to have to be like, all right, let's go.
Yeah.
And just fail if you have to fail, and if you have a local specialist, send it to them, Don't do anything that you're scared you're going to hurt somebody. Obviously, there's a limit to this, and it depends on the procedure. But if you feel like you can push yourself comfortably without doing irreversible damage that somebody else can fix, and the patient's cool with you doing it, then go for it, And you have a good set of specialists that potentially will be able to bail you out. I did some extractions, and I didn't get them out. But I had a great private practice oral surgeon that was down the road, and he said, he came to me and he said, I want you to succeed. It was the weirdest conversation ever. He's like, if you want to try something, go ahead, and I'll be here for you if you need me to finish it. And if you want to come with the patient, I'll show you how I finished it. It was a really strange offer from a specialist. I feel like a lot of them can be standoffish in that regard. And he was like, I have enough work. I'm good. He's like, if you just want to learn more, feel free to shadow at any time. But like I said, that can be in that private practice situation. But if you're in a group like ours, then even someone like myself is like, if you need me there, then we'll set it up.
Right.
You know? So if you're like, I'm ready to tackle my root canal, then I'm going to be right there next to you. You know, we have other doctors who are ready to be right there with you.
Yeah.
So that's the few different scenarios you might, find yourself in.
What advice would you have if you're a dentist and you're having trouble presenting to a patient because you are worried about their finances?
I've come to realize that you can't worry about their finances. You have to worry about them. You know, once you've done a certain amount of dentistry and you've seen success, and you've seen success in terms of treatment outcomes, you know, this is finances out the window.
Yeah.
You know, you do a root canal and you watch the infection disappear over a year, you know, and then your treatment gets bigger, right? You do a full arch of crowns and you see the happiness that they have from it, right? You do a full mouth of crowns, you do a full mouth of implants. And just yesterday, we had a patient want to come to the front and take a picture with me and Dr. Gibby. And he was like, I'm posting this everywhere. It's going everywhere, you know? And that was an implant case. And like, whenever you see the other side of it, then you're not scared about the finances because you realize, you know what? Like, I actually am helping people. I'm not just a tooth mechanic, you know? Like, we actually can make a difference, and, you know, pretty lucky. I happen to get paid for it, you know? But it takes a while to get over that because you have to see that the things that you recommend work. If you recommend orthodontics and you see the teeth straighten and you see the final product, you're like, oh, holy crap, dude, it worked. It worked. Now I'm more confident to present the next one because I have success prior. Yeah. You know? And you will. If you do enough root canals, one of them's going to work. One of them somewhere along the way, you're going to get one. Yeah. Okay? And if you get one, then you'll get your next one. Right. And then the next thing you know, you're going to walk into the room is, you need this root canal, we're going to take great care of you. Yeah. Because, like, there's a pretty dang good chance it's going to work. Right? Yeah. You know? Because you've seen it. So that's the thing is, you're a new grad, you don't even know if your filling is going to work. You're like, I hope it stays in there. If I glue a crown on, I hope it doesn't come off next week, because you don't understand anything. Yeah. You know, you haven't seen your crown come off yet. You haven't seen your crown last for 10 years. So once you experience those things, your confidence builds internally. Yeah. And you're just
How often are you thinking about big cases you've done that have gone well when you're facing something new? Or is it subconscious at this point?
It's getting close to subconscious, but you know, I used to worry about everything that I was unsure of. I couldn't sleep. I was like, oh my God, I've got a molar endo on my schedule the next day. I'd study all night. I would not sleep. I would wake up. I would come in. I would ask questions. I would just be prepared for everything that could potentially go wrong. Right. And now, you know, I don't really worry much anymore. I'm in a new season for sedation, and there's going to be a lot of challenges I'm going to experience as I navigate that world. And I would lie if I'm not nervous about that. But once again, if you're uncomfortable, that means you're probably doing something right. Yeah. So it's a mindset thing that I've learned over the few years, you know, is like, if I am comfortable, then what am I doing?
You told me one time about anxiety. You said that was my body preparing itself for growth. Yeah. I remember that.
Yeah, that's exactly. And I'm nervous again. I'm nervous. I mean, because, you know, my sedation permit is, I've got a verbal exam with an oral surgeon who's going to destroy me. And then I have to do a sedation case in front of them, and they check everything off just to make sure it's done properly. So is it a good thing for the general public? Heck yeah. And that's what I'm telling myself is they're doing it this way because it's good. And it means I need to be better. I shouldn't be scared of it. I should show them how good I am. So if I think it's coming in the next couple weeks, I'm going to buckle down over the next couple weeks. I'm going to hit the books and I'm going to study. So if they ask me anything, I want them to be like, oh my gosh, wow, you actually kind of know this stuff, you know? So that's the way that I've learned to accept these things as time's gone on, where it used to be a crap ton of, like, oh gosh, I just really hope I don't mess up. I don't want to mess up,
right?
Because I'm perfect, to realizing that, I've watched enough of my dentistry not work in the short amount of time that I've been a dentist. And I'm like, all right, things just aren't going to work out sometimes. And it's okay. Yeah. How are we going to fix it?
Yeah.
How are we going to fix it? And that's where I'm at now,
Gotcha.
And it just, unfortunately, it's just time. Time gets you there. But now, that's my latest anxiety, if you will. But I'm ready because I've done this before.
Exactly.
And I'm not going to lose sleep over it. But, I know my systems and I'm going to have to prepare, and that's okay.
Right. You mentioned your wife's a dentist that works with us too. How much of your life is dentistry and talking about dentistry, even when you're at home?
There's a fair amount, Cause for me personally, it's, I work here. I work with two other dentists that we try to bounce each other's ideas off of after hours sometimes. And I'm fortunate enough to also receive, questions from other dentists at random times. I never know when that's coming, and on top of that, my wife asks a lot of questions too. And between all those things, I would say I'm a little more on than I thought I would be. We leave the house at 6:40 something, and we get home after 6 or after every day, and then we talk dentistry at dinner typically. And when it comes to the weekends, I most of my Facebook feed is dentistry. So I kind of just see it, and I read Clinical Pearls because there's a lot of great dentists out there that I can learn from. And all those things combined, I would say, there's maybe a total of a day and a half combined in all the hours every week that it's something not dentistry, but I'm okay with that because I'm lucky. As like, you don't know when you get into dental school if you're going to like it, because you didn't do it before. You just applied. You were like, well, all right, here we go. You start doing it, and some people hate it. Unfortunately, there's a few dentists out there that are like really just hate being a dentist. And I'm one of the fortunate few that is like, you know what, like there's tough days, as with any profession, but it's going to be okay. And I really like teeth. It's cool.
Yeah.
But it took me a little while to realize that. But yeah.
Would you say you're fulfilled now still? Would you say you're more fulfilled than you thought you would be?
Yes, but as I grow, I need new challenges. And I would say there's a few more things in dentistry that I would like to tackle, clinically speaking, of course, and within those things you can learn till the sun comes down. So I'm never going to be perfect. But in terms of like a great, strong eagerness to learn, there's a few big topics that I have left to really get into, and after that, like, I'll be fulfilled in that portion of my life.
Right.
But what's next?
Right.
But
your fulfillment as a whole is what pushes you. And I don't mean content. I mean fulfilled. Like I love what I'm doing.
I'm very content, or I'm very happy with how life's gone, and I'm proud, and even at my young age, I start to look back now
Mm-hmm.
and be like, okay, that's where you came from. And we've made it this far. And I'm proud of that, you
Mm-hmm.
know, and it took me a while to do that and be proud of it because my dad taught me, you know, what happened to the other 7 points.
Yeah.
Where's the 100, you know?
Is
So,
he proud of you now?
heck yeah. He said, you far surpassed anything I could have ever imagined for you. And, you know, we have a much better relationship now, which is good. But you know, I really enjoy, I think there's benefit in taking a second to pause and just be like, okay, you know, you've done a lot and it's okay to be happy with what you've accomplished. You know, let's go get some more.
Yeah.
But come on, I mean, you did all right,
Mm-hmm.
you know, and now that I'm doing that for myself, you know, I'm everything's full circle. It applies in the practice too.
Mm-hmm.
Is, you know, I probably haven't told my team enough that I'm proud of them and that they've done a good job.
Yeah.
And I appreciate them, because where's the other 7 points?
Mm-hmm.
You know, because that's just how I'm wired. But other
Yeah.
people aren't wired that way.
Yeah.
And you have to learn to tailor your leadership to the situation. And I admit fully I failed at that, and I'm working on it. So
Yeah.
that's the next challenge, is actually becoming a true leader
Right.
that I thought I was and didn't realize. It's like graduating dental school. I thought I was a good dentist. I'm not. I wasn't. You know, I thought I was a leader. I wasn't anything. I was a dentist.
Mm-hmm.
You know, and now I'm having to actually become a leader, and you realize you don't know anything, right? So I'm just starting again in a new realm,
Right.
and trying to be consistent and actually apply. That's something else, is like follow through, actually apply what you learn, you know, like don't just talk about it.
Yeah.
And I've talked about it a lot.
Yeah. No,
But
this guy I listen to for leadership, he says, we don't have an education problem, we have an application
Oh
problem.
my gosh. And once again, my own worst critic, as I've realized, I was like, man, I was a lot of, you know, was it big hat, no cattle?
Yeah.
You know?
Yeah.
I was like, man, I'm a really good listener. I can talk pretty good, but I didn't do anything, you know? And I just had to be humble enough to realize that I didn't do anything.
Gotcha.
And I went and I've apologized to almost every single one of my team members for not being a good leader. And I'm going to do better, and I'm going to take care of them.
Yeah.
You know, and you just have to, it's okay to mess up.
Yeah.
And just carry on. So that's where I'm at
Right.
right now. So,
yeah. Well, I want to thank you. You've actually helped me be a better leader, because you have high expectations of people. And I knew once we started working together, like it was a different caliber of just mindset that I had seen, you know, back in 2019 or whenever we first started talking, because I had only been in dentistry a couple of years. And I was just like, oh, okay, this is out there. We need to appeal to this person, and we need to live up to your standards, because I knew that you wouldn't tolerate anything less than the best. So I've appreciated that about you. And I really look forward to the next seasons with you.
Yeah.
Yeah. So
we'll keep getting better every year.
All right.
So it's been a pleasure.
Thank you.
Thank you.